That's the word coming in from the PNB management. Lots of other earnings as well to number crunching on. Let's take it across to Viren Shetty, the ED and Group CEO at Narayana Healthcare, joining in the show right now. Viren, hi, morning. Good to have you on the show. If you could just help us understand what exactly is the recovery when it comes to occupancies at your flagship as well as your Southern Peripheral hospitals.
Yeah, morning. The occupancies at our flagship continue to struggle, mainly because of the lack of international patients that are coming in. And our flagship hospitals used to get patients from all across the country, mostly patients from East India coming to our hospitals in Bangalore. With the limited mobility and the fact that people are quite reluctant to travel in planes and trains, so on, that reduction in footfalls has been significant. So I would say in the flagships, where a normal occupancy would have been around 60-70%. We're looking at anywhere from 38 to 45%. Having said that, this was the Q2 numbers. The October numbers have looked much better, and we expect November to get better. As for the tier 2 towns, the occupancy never really dipped a lot, primarily because the incidence of COVID in those places was a lot less. But it definitely did have an impact, given that these operate on a much smaller base. Hopefully, we're expecting Q4 to achieve full normalization in daily run rate.
Sure. Give me a breakup of what the EBITDA has been like at individual new hospitals, and is there a revised guidance that you're going to set out for new hospitals for the EBITDA break-even?
Yeah. We don't split it up by hospitals, both in our disclosures, nor do we give guidance. But I would say that across all the hospitals, it is hovering on the verge of break-even EBITDA, with the only exception being the cardiac hospital and the Calcutta hospitals, which would take slightly longer to get there. Some of the hospitals that we operate, let's say in Raipur, Shimoga, Mysore, so on, are profitable anyway. As for revised guidance for the new hospitals, pre-COVID, I was quite confident that one of our Delhi units would break even. The Gurugram and the Mumbai one would take somewhere till the end of this financial year or early next financial year. The Dharamshila hospital in Delhi has broken even and will continue to improve given the strong occupancy and footfalls there, as well as its oncology focus. The Gurugram and Mumbai hospitals, we believe, should bounce back. So I still feel confident that it would break even in FY22. But having said that, I would hedge it based on what we understand of this pandemic to be quite long-lasting in nature.
Okay, what about the commentary as well on the sustainability of high payable days?
That is not sustainable. The truth is we have spoken to a lot of the vendors and they've been willing to share the pain with us, given that our own receivables have been stretched with the government not clearing a lot of bills on time. But as and when things normalize is when we expect also to get back to normal payable days.
Just give us some sense of the numbers as well, the EBITDA breakup, the margins, just to sort of get a flavor of the performance and what you're anticipating going forward.
I would say on the EBITDA breakup, we have the southern zone hospitals, which are in the tier 2 towns, which are the only sort of break-even zone that we have. Bangalore is around negative 6.2. EBITDA, Kolkata negative 4%, the Eastern Peripheral Hospitals negative 8%, hospitals in the West negative 1%, Delhi negative 10%. So all of them at different stages of recovery. And I would say that Q3 would look a lot better, but definitely not anywhere close to normal, given now what we understand to be a set of resurgence in the Delhi zone, as well as Mumbai with increased COVID infections and preparations being made for a second wave or third wave. I can't keep track anymore.
Yeah, unfortunately, it's been so many months, and you guys have definitely been at the forefront of this pandemic. But Viren, just wanted to get a bit of a holistic picture from you as to what the outlook is on the healthcare sector as a whole. Is it poised for a lot more consolidation? What's the sense that you're getting as well as to how we've dealt so far with the pandemic?
I think globally, decision makers across the world have realized that the healthcare system is tremendously broken, because when the economy of the world has to take a stop in response to one single disease, it gives you this real feeling that healthcare isn't working. And while primarily was a third world phenomena, even the Western world has realized that their healthcare system is as rubbish as ours is. So I'm hoping this spurs a lot of policymakers to invest a lot more in healthcare infrastructure and build up more doctors, build up more nursing institutions, and that will solve a lot of the core supply issues that our sector's always had. As for consolidation, yes, it has been extremely challenging for smaller hospital providers. So hospitals like ours that are large and operate across multiple cities are better cushioned, because while some cities perform worse, other cities perform better. And because we have multiple departments, cardiac surgery, which is down by half, has been supplemented by oncology, which has doubled compared to the normal run rate. Smaller hospitals aren't able to do that. So I expect to see a lot of consolidation going forward. But obviously, it has to be driven also by the valuations and the sort of reality of this changed business circumstance.
Okay. And, can you give us some sense in terms of what the outlook as well is in terms of what you're expecting? You spoke about some sort of private investments coming into the healthcare sector. Is there any sort of government initiatives that you would like to see in order to help improve the healthcare system in the country?
Sure. A lot of the things that the government has been doing is on the supply side. A lot of this goes unheralded. Obviously, a lot of spend on Ayushman and those sorts of programs get a lot more attention, but it is the background work that is happening that we believe has a much more sustainable impact over the long run. So the government has launched diploma programs for a lot of these ancillary departments like maternity, radiology, cardiology, intensive care. So these will help deal with a lot of the smaller issues that crop up in hospitals. Not all medicine is done by specialists. A lot of the work is done by nurses, nurse assistants, physician assistants, and subspecialists. And that is something the government has tried to improve in terms of supply. But in fact, it's simply not enough, because across the world, what we're seeing is that Western countries have completely opened up the gates to allow medical professionals to enter their country. And as the economy in India gets worse, a lot of doctors are looking at emigrating to Europe, the US, the UK, which just means that we need to start producing a lot more doctors to be able to cushion that impact.
We'll let you go on that note, but appreciate your time. Thank you so much for giving us a clearer picture as to what the outlook has been on the healthcare industry, as well as for your company in specific in terms of the outlook in the smaller towns as well as back home, and what you're seeing at your flagship by way of occupancies.